inclination towards the pathology field, micro field, you will be zero. You cannot become a good doctor, cardiologist, neurosurgeon, oncosurgeon without the help of these people. Radiologist, I think from your batch 1 or 2. Okay, the word, I think so. What I believe, you people have seen only the cream of doctors. You don't know what the doctors do at the periphery, what is a health sector. You know about the major hospitals, Fortis, Max, Vedanta, Breach Candy Hospital. They are doctors. I think you have met these kind of doctors there, है but you don't know what is there in the rural services, rural health, a PHC, primary health center, a community health center. Because a cardiologist is examining a patient with some MI, but along with that, he has dengue fever as well. Cardiologist is not going to save the patient. Dengue is going to take the life of that patient. You are not going to get a simple cases in future. We have dealing with only Haji fever ho raha, ye ho raha, nahi. Fever of 1 month, fever of this, and with additional things. ठीक है, cardiologist, simple case, clean case, heart attack हुआ, stunt डाल दिया, it's good. But अगर उसे कुछ complication or infection occurred in that person, he may lose. But नाम किसका खराब होगा? Cardiologist. अगर कार्डियो ने ऑपरेशन किया और सक्सेसफुल नहीं हुआ और पेशेंट का रिजल्ट अच्छा नहीं मिला. So I think so it's a balance. In your batch of 150, right now you are thinking you will become cardiologist, you will become things depends on lot of experiences also in your future. You will come across subjects and then you will go through the topics, will study, then we'll read through the topics and then experience in the wards. Your maybe whatever you want to become might change in future. And we'll get experience in all the clinical branches and paraclinical branches. So what is the expectation of NMC from about a basic doctor? Basic doctor is when you will pass this 4 years of journey, you will become after completion of 1 year of internship, you will become a doctor, physician, right? Now what are the expectations? So prevention, more focus is on prevention. And then they should be skillful enough to deal with patients and community effectively. It is not in your closed chamber you're dealing with a patient. You have to deal with the relatives of the patient as well. And then lastly, basic administration of a health center. Might be some like previously they were like thinking of rural bond and all that rural services. You will learn in community medicine. You will visit homes, you will visit certain areas and what at the ground level health sector is doing, you will learn about those things. Now, diagnosis and treatment of common diseases. So what are the common diseases? Yes? Common cold, meaning upper respiratory tract infections, है ना? Upper respiratory tract infections are common infections. Then second, fever, acute fevers, short duration of fevers, right? Like infections. Infections हो गया, fever तो उसमें होगा diarrhea. Now we are dealing with pulmonary tuberculosis a lot. Every patient, elderly patient coming to us in the medicine department or the respiratory medicine department, we have to evaluate that person for tuberculosis. And mind one thing, everyone is aware of the pulmonary tuberculosis. but there is one more term, extrapulmonary tuberculosis. Extrapulmonary tuberculosis can affect each and every organ of the body. Right? Not it is very common in the lungs, but it can affect skin, it can affect brain, it can affect the layer of the brain called meninges, it can affect layer of the heart called pericardium, it can affect bones, it can affect female genitalia, it can affect male genitalia, it can affect fertility, it can affect bones, joints. So tuberculosis can affect. Now we are dealing with one problem. The common drugs which were effective and helpful in curing the patients, they are not showing response in a patient. We are dealing with multi-drug resistant tuberculosis. And right now, the person has to take medicines. First challenge is a diagnosis. Second challenge is then to look whether this is only a it is a drug sensitive organism or a drug resistant organism. And then further is there extreme drug resistance, multi-drug resistance, extreme drug resistance. So tuberculosis is a very big challenge for India. And what about the abroad? They used to do screening in abroad in few developed countries. Infections are less, but when that reaches, then it creates lot of problem over there also. So it is like because of the globalization of the world, now diseases in one part of the country can reach to whole country and then can spread to whole of the world in a couple of months. COVID has taught us this thing at least. Any strain, any evolution in the mutant strain took only, I think this time Omicron has taken only 3 weeks to reach all over the world, and there were few of the continent, I think, areas where it was not there, but Omicron reached there also. It is because of the globalization. People move, people travel, the infections can come. Okay. So one of the challenge is infections. So one should be capable of diagnosis and treatment of the common infections. Common infection is tuberculosis, malaria in India, leprosy, chikungunya fever, dengue fever, other infections, right? In the adult level and children and all the population. And then non-communicable diseases. One is communicable, the other is non-communicable. Communicable are which can spread from one person to other person. Non-communicable are like diabetes, hypertension. This is also an epidemic of diabetes. After COVID-19, so many people are diagnosed with diabetes. Diabetes has increased exponentially, right? Because of the injudicious use of drugs, or COVID has caused something to the pancreas because of hyperinflammation. But we are getting very recently diagnosed diabetics, lot of patients post-COVID. Then hypertension and heart problems, strokes, paralysis, brain problems, they are non-communicable diseases. Why this is important at this level? Because prevention, डायबिटीज का क्या प्रिवेंशन है? हर एक चीज का एक ही प्रिवेंशन है, हेल्थी लाइफस्टाइल एंड हेल्दी ईटिंग. और हेल्दी लाइफस्टाइल में क्या है? लाइक फ्रॉम ईटिंग टू योर एक्सरसाइज, all is very important. We like a lot burger, pizzas, but these are not healthy things. White things like maida, refined flour, not good for health. Just saturated fat, the oil which gets solidify at room temperature, like butter, your ghee, some desi ghee, they are not good. That doesn't mean ki, I think we being Indians, it is into our lifestyle ki we have to eat spicy and something occasionally. We can eat, but it should not be part and parcel. We should not start our day with this. So this is the like diabetes, healthy lifestyle, healthy eating, weight control. These are the mantras for all the diseases, in especially communicable. Because if diabetes is more, if hypertension is more, they will lead to more cardiac problems. Then our cardiologists are going to earn a lot. We don't want to give them this chance. In this batch we'll get 50-60 cardiologists. They have to wait for the patients, because some of you wants to become a good doctor. There comes the role of a good doctor. At the community level you have to work. Now it is not a person is coming to me, if in my OPD, like if patient comes to me, it is not my only job to counsel that patient. I counsel the relatives also. ठीक है, because एक तो हो गया बीमार, दूसरा ना हो जाए. ठीक है. How we can prevent infections? Infections को prevent करने का सबसे बहुत कॉमन चल रहा है आजकल इंडिया में. Infections को कैसे prevent करना है? Hand sanitization, hygiene. And you know that कि India में overcrowding is a big problem. ठीक है? So that's why it is there. Still we are dealing with the communicable diseases. So that is ventilation, hygiene, hand wash, proper disposal of excreta are big challenges at the health level. So our health sectors are busy in that. They provided man-made bath toilets at the village level, but even then people have the habit of going and doing defecation openly. It's a big challenge because it leads to spread of lot of infections. How come? How it spreads? Because it goes into the water, and water we consume, we drink that water, and we become ill with that. So these are the challenges: malaria, dengue, hepatitis A. You know, hepatitis A is by ingestion of contaminated water or food stuff, right? Malaria is by the bite of mosquito, but where the mosquito grows? Stagnant water. तभी तो जब भी सीजन आता है, rainy season, the BMC or municipal people starts doing spraying, fogging, DDT powder spread, है ना? और हम लोग अपने घरों में जालियां. This is also part of cure, prevention. हम लोगों के आजकल दरवाजे जाली, मच्छर should not enter. Skills are important because if we are interacting with a patient, should be convinced. Otherwise, now we use one term, doctor shopping. New to you people, na? Doctor shopping. Google doctor, Google Baba, Google doctor. अरे हमने कुछ बता दिया, अरे हम खुद दूसरे डॉक्टर, वो ज़्यादा अच्छा डॉक्टर है. और अभी भी I think so बहुत सारे लोगों के घरों में ये प्रॉब्लम होगी. I say I'm a doctor, but I'm not a doctor at my home. Rest all are doctors. Rest all my family members are doctors, but I am not a doctor because I will advise lifestyle modifications and medicines. They will advise क्या like करेले का जूस पी लो, शुगर है तो. काढ़ा बहुत चला है. काढ़ा बहुत चला है. And then people faced some problems also, bleeding problems, lot of bleeding problems, and still studies are going on कि it is affecting the liver also. तो हर चीज करनी, काढ़ा is good, यार Indian medicine is good, but not in excess. Excess तो मैं कहती हूँ our medicine is also not good. Excess of everything is bad. Like super speciality subject about that disease, what is the anatomy, physiology, how the disease happens, treatment, and then how it is to be applied to the patient. A patient coming to my OPD first time, elderly a middle-aged female patient, and I advise, she give me some complaints about herself. Then like एक पेशेंट आती है मेरी ओपीडी में एंड कहती है मुझे बहुत प्यास लग रही है आजकल और मुझे बहुत कमजोरी लग रही है. तो I listen to her, right? I know she is a female by name and by appearance, and then date is mentioned on the OPD slip, residence is mentioned. I know which area she belongs to. Then I'll listen to her complaints and I'll ask certain questions. ठीक है? What is the duration? She will tell me about the complaints. Duration usually patient forget. Some people don't want to go for the investigations. Test नहीं कराना चाहते. You have to convince them why there is a need of test. Because then I will try to understand her na कि there is a need of test. You should go for it. What will come to my mind? Generalized weakness, dryness of mouth, increased appetite. I'll ask increased appetite, frequency of urination. With her two complaints, in my mind of middle-aged patient will come about the disease of diabetes. ठीक है? I'll ask about the family history. She will not get convinced or sugar करवाना क्यों करवाएं? इसमें clear हो जाएगा ना, देख के तो नहीं पता चलता. Like face doesn't tell. At times, emergencies tell the condition of the patient. Otherwise, hypertension, 150 by 100 BP, 160 by 90 BP, people will move around like this. They will not suffer any complaint which will hinder their lifestyle or schedule of the daily activities. So people will not come. If there is a complaint, they are facing it is increasing, they will come. So you have to understand her. Because of this, please go for these investigations. And then she will go for the investigations. After 2 hours back, collecting the reports, will report to my OPD and I'll see, and our sugars will be 400. Okay, है, but अभी आपको लक्षण है, दवाई शुरू करना पड़ेगा और आपको अपना डाइट का भी ध्यान रखना पड़ेगा. तो पहला क्वेश्चन होता है कि अगर मैं कहूँ कि चीनी बंद करो, तो people have other ways also. No, diabetes is very common among the masses and they are well aware of it. They say गुड़ तो ले सकते हैं ना, because diabetic follow-up is very very bad. I know सब कुछ नहीं खाते हैं, but तभी शुगर कंट्रोल नहीं हो रही है. कुछ तो नहीं खाते, प्रसाद तो नहीं खाया कहीं. These things happens to my family. My father-in-law is a diabetic and he finds different ways to eat मीठा. Like प्रसाद कैसे मना कर सकते हैं ना, पाप चढ़ जाएगा. डायबिटीज तो कुछ नहीं करेगी, बट अगर प्रसाद नहीं लिया तो पाप चढ़ जाएगा और उससे वो बीमार हो जाएंगे ज्यादा. So these are the ways adopted by the people also to cheat themselves, and you have to convince them to you have to change the lifestyle, but in a staggered manner. Not all the things to tell them ये करो वो करो वो करो वो करो, नहीं. My first request, it is a request to them, please stop chini, gur and sugar. This experience I collected from my 10 years of practice, because हाँ चीनी तो नहीं खाते, नहीं चीनी नहीं खाते, but I was not where they switched to gur. It is people believe कि gur is healthy and chini is not good. So they switch to good, and this is less meetha, this causes less harm. So you have to go into the root cause. I'm a physician, I have to treat. surgeons, others have to look for the cause कि क्या हो. देखिए, treatment is easy. I will give medicine, I will advise.